Today, we're going to discuss a very important topic, which is relating to the forensic psychiatry. So, it's basically the continuity of the previous lecture in which we discuss the importance of the forensic interviewer. Why does this interview has so much significance? We evaluated these factors that it is important to conduct this interview in this particular atmospheric conditions. What are the prerequisites for this interview that are required? And what are the safeguards that should be present? Because it's again very important to maintain that thin line between the safety of the interviewer and, on the other hand, the confidentiality of the detainee. So these are the two aspects that we're going to consider whatever interview we are going to conduct. We evaluated the factor that it's very important to conduct this interview, and the suicidal rates have decreased in the United Kingdom, according to the researchers, after the conduction of an appropriate interview with the detainee of the forensic practitioner. Because he evaluates the factors that basically highlight the facts. The suicidal intentions of the detainee are also highlighted during the interview when it is conducted. If there are any signs of self-harm, we summarized the major signs of self-harm being the tentative cuts, being the hesitational cuts that were significantly present on the accessible parts of the body of the detainee. When you're conducting this interview, it's very important to have that complete knowledge regarding the detainee with whom you are conducting this interview. You can get the corroborative history from the friends, the corroborative history from the family. Why is this corroborative history important? Why is this homework very important over here? Because when you conduct this homework, it is going to highlight the factors, what kind of the personality the detainee had before he was charged with a certain kind of a crime. Was he capable of conducting this kind of a crime? Had those personality traits which made him more prone to the assessment of such kind of a crime? Was he suffering from such disorders, from psychological disorders, from psychotic disorders? Was he suffering from some sort of hallucinations, delusions? And then obviously there are a range of other disorders. For instance, anxiety disorders, we have panic disorders, we have mood disorders, and more commonly we have the bipolar personality disorder, which is very common, in which basically the patient has two phases. One is the phase of mania, which is coupled up with the phases of depression. So this is very important that you conduct this corroborative history, you do your homework before you go to the interviewer. As an interviewer, you go to the detainee and conduct that specialized interview in a specialized atmosphere. So this is one of the aspects. When you enter the room in which the interview is to be conducted, this is again a very important point. The first impression of the detainee is again very important. Before even the detainee speaks up to you, before even you put up your questions to the detainee, it's very important that you look at the overall appearance. There can be signs of self-neglect, which are very important and particular significant signs of depression over here. So these are the main aspects when you conduct this particular kind of interview. Even before you start on with a particular kind of questions, may it be the leading questions or may it be the open-ended questions, and you ask the detainee to answer your questions in a particular manner, you're going to look at the gestures. Are there any signs of ataxia, dystoidokinesias, and all of these are basically going to point out towards the organic disorders that the patient might be suffering from. Are there any signs of Parkinson's disease, for instance? Tremors, pale rolling tremors are a very significant sign of Parkinson's disease. So cogwheel rigidity is one of the other signs. So the normal movements have to be observed, and you have to document even the observations down into your interview. You can just make a separate column for the observations and just write down your observations accordingly as you note them down during the passage of the interview or during the duration of the intact with the detainee. Now, here comes the most significant and the most interesting part. Once you have evaluated that the patient is suffering from some sort of a mental disorder or not, and what is the mental health status of this particular detainee that we are conducting the interview with, the next step would be we must be detecting any false confessions. So there are different varieties of false confessions, and it's a very common thing that usually the detainees would confess to the charges which they have not committed. Now, why does this happen? Why do they confess to charges which they have not committed? There are particular reasons behind it. There are three basic categories. On the first, we have the voluntary kind of false confessions. Then we have the false confessions due to the coercive behavior of the police interrogation. When I use the word coercive, it is basically referring to the threats, referring to the force that is basically inculcated by the police investigation, and as a result of that particular kind of the interview or the particular kind of police investigation, the detainees usually confess to the charges which they have not committed. The very first part of this false confessions was the voluntary kind of false confessions. Now, this is very interesting. Here comes the part where you would be analyzing the personality of the individual. Some personalities are more prone to confessing to false charges. What are the traits of those personalities? We'd be discussing that in our lecture in detail. Suggestibility is one of the trait, compliance is one of the trait, and all of these traits, if they are present in the personality of an individual, he's more likely to confess false kind of confessions while he's in the custody of the police. Again, it can be some sort of guilt that the patient or the detainee might be suffering from, and he or she might want to punish himself or herself. So this is one of the aspects to look at the things. On the other hand, we have one of the very major criteria, which is the protection of somebody else, someone dear to that detainee, and that dear person has basically committed the crime, and the detainee wants to protect that particular person, and that is why he or she is making those false confessions. So this is one of the way over here in which you can think, and this is one kind that you have to interrogate while you're taking the interview. You must be knowing who were basically present at the crime scene. Were there any close relatives, close friends? Or could the police find out any fingerprints relating to the relatives or the friends? And that would basically highlight the factor that even that person can be the real criminal or the person who has basically committed the offense. So these are some of the criteria over here. On the other hand, the mental capacity, having the insight towards the charges. So you would be assessing the patient, and we've already done that. We have different exams for that. We have the mini-mental state examination techniques by which we can assess the mental condition and the mental capacity of the individual, whether he has the internalized factors towards the offense or not. This is very important. Having the insight of the offense, having the insight of the crime. For instance, people suffering from schizophrenia, they lose the insight, and due to that factor, they can make false confessions. So it is one of the factors that you have to consider over here. and you can basically interrogate. It's not basically a part of your interrogation, it's basically a part of your interview. You can interview the individual and find out whether he's suffering from some sort of mental delusion, hallucinations, or maybe he has lost memory of that particular incident that took place, and that is why he's committing that. Maybe it was him who committed that particular offense. Substance misuse over here is one of the very important factors. Sometimes people who are drugged, people who are intoxicated due to alcohol, they usually commit false confessions. And that is something that you have to evaluate when you are conducting the interview and you are assessing whether during the interview the patient has been drugged or is intoxicated with alcohol or not. So these are the three capacities that you have to work on, and only then you can evaluate the chances of false confession in this particular individual. Now, as I've already mentioned, we have the coerced false confessions and we have the internalized false confessions. What is the difference between these two? These are two different entities, basically. The coerced false confessions are due to the force or due to the threat that is used by the police officers, and the internalized false confessions are due to the loss of memory. So these can be the types of false confessions that might be committed, and you have to evaluate and you have to basically assess the patient whether he has made any sort of false confessions or not. Fitness to interview is again very important over here. How do you define fitness to interview? This is again very important, and it has been defined in very clear words that any interview which can distort the mental status of the individual is basically highlighting the factor that the detainee is not fit for the interview right now. It can be any physical illnesses, physical ailments that the detainee might be suffering from, and it has all the other particular causative factors contributing towards it, and you have to again assess whether the detainee is fit to be interviewed in this particular situation or not. So moving on, we have the factors that increase the false confessions. What are the factors in the environment, the internalized factors of the personality of the detainee, which can make the person more prone to committing false confessions while he's in the custody? So this is very important over here. So this is a mnemonic which will help you remember basically that what are the factors of factors that are basically contributing towards an increase in the false confessions. The number one is the personality. So the personality of the individual is very important over here. Whenever I use the word personality, what are the particular traits that make the person more prone to committing false confessions while he's being carried out with a custodial interrogation? It is the susceptibility. When you put the closed-ended questions to these particular personality holders, they're going to have the false confessions. And that is basically, that can be due to a low IQ of the individual, a poor educational background of the individual, or any psychological ailment that the person might be suffering from. So this is one of the significant factors that you have to consider over here. Moreover, what are the other risk factors that can influence and increase the confessions and the rate of the false confessions is the health of the individual. So whenever we are considering the health of an individual, we must consider the fact that even the definition of health, which is given by the WHO, it comprises of the physical, mental, and moreover, the spiritual well-being of the individual. So we have to consider all of these factors even over here. When I say we are considering the physical ailments of the individual, it can be any long-term ailments that the person might be suffering from. So if he or she is suffering from diabetes mellitus or hypertension or any prolonged debilitating illnesses, it can induce anxiety, it can induce depression in these particular individuals. And so basically the physical health and the physical well-being of the individual is connected with the mental health status of that particular individual. Moving on, when we consider the mental health of the individual, we're going to analyze if the patient is suffering from any sort of anxiety disorders, mood disorders, personality disorders, or any kind of psychotic disorders, for example, paranoia, schizophrenia, if he's suffering from any sorts of hallucinations or delusions, and even learning disabilities. So the questions are going to be put forth in a similar manner, and you're going to ask the individual whether he or she has been suffering from any sort of difficulty when he was in his school and colleges, and maybe that is going to highlight the factors of dyslexia, or even any patterns of autistic disorder if they can be observed in this particular individual. Bipolar disorders are sometimes associated with phases of mania, which are coupled up with phases of depression. And whenever the person is in a phase of mania, he might be capable of committing some sort of a crime. Spiritual health is also considered over here, and these are the two basic ailments that we're going to consider over here. And then finally, we're going to consider any substance misuse, any drug abuse, or any kind of intoxication that the patient had in his previous past, or that is going to be documented in detail over here. Because intoxications lead to hallucinations, intoxications lead to delusions, hallucinations of all kinds, visual hallucinations, auditory hallucinations, tactile hallucinations. They're usually coupled up with the use of drugs. So this is going to be even documented when you are writing down the particulars of this patient over here. Now the interview characteristics. So even over here, you're going to look at the characteristics of the interview. What kind of an interview was conducted? Was it a coercive interview which had forces, which had threats that were included in it? Closed-ended questions were usually put forth in the interview. So even that is going to be highlighted, and the mental capacity is going to be highlighted over here. Moreover, we have the totality of circumstances, the circumstances of the environment, the access to the legal advice is very important over here. The periods of rest in between are very important over here, and any significant social distractions, if they are present, that can lead to a diversion of false confessions in this particular individual. So you have to really memorize this mnemonic that is fit, and this would lead you to basically attain these factors, assess the personality, assess the health, the circumstances that are involved in a particular case that you're dealing with or that you're documenting as a forensic practitioner. Now, what is your role as a healthcare professional? Once you have conducted the interview and you want to move on and want to know whether the person is deemed for the interview, whether he's fit for the interview or not, as a healthcare professional, as a forensic practitioner, what are the questions that you're going to ask yourself? So first of all, whether the person's condition is likely to improve or not. So there are different prognostic factors related to different physical conditions, related to different mental conditions, may it be schizophrenia. You know what are the particular prognostic outrates out there, and you're going to consider those factors over here. Considering hospitalization over here that we're going to discuss further on. And what is basically compulsory hospitalization? How do you assess the patient when you hospitalize the patient? How do you treat the patient over there? What is the team of doctors that is available out there, which is basically going to help you out in a particular case. So knowing the condition or diagnosing a person to be suffering from some sort of a mental condition and then aiming towards its treatment is very important. That is basically, that is again going to make the mental capacity of the individual more highlighted over here and giving the insight towards to the detainee regarding the crime, regarding the charges, and whether he's fit to plead or not. So these are the circumstances that you're going to consider if the detainee is suffering from some sort of a mental condition, some sort of a psychotic condition, and you want to have a appropriate treatment conducted for this particular patient out there. The next question would be whether the condition requires or is amenable to treatment. So this is again very important that you consider these factors over here, that some of the psychotic conditions are not treatable. And if they are amenable to treatment, then only you would advise that particular hospitalization and that particular treatment for that particular patient. Thirdly, you're going to ask how long it may take for any improvement to take effect. So this is all that you're going to be asked as a healthcare professional. It's not only that you're going to diagnose a person and your role is over. You're going to diagnose a person as well as you're going to manage a proper treatment guideline for this particular individual and make the custodial in charges referred towards this fact that how much time is it going to take for the treatment to take place and what will be the outcomes towards this particular treatment that the patient is subjected to. So this is how you're going to play your effective role as a healthcare professional, play your effective role as a forensic practitioner, as a general practitioner, whenever you're asked to conduct an interview with a detainee and you have diagnosed him to be suffering from some serious mental condition or some serious psychotic conditions. Fitness to interview, as I was already emphasizing on the fact that there are particular definitions towards a person to be fit for the particular interview to be carried out. Usually, when the illness is worsened by the interview, we regard basically the detainee that he or she is not fit for the particular interview. Now, what are these conditions that aggravate, that worsen after the interview is being conducted? It can be an ischemic heart disease because all those coercive factors, all those threats, all those forces that were conducted, that is again going to make the condition worse. And once you carry out this interview, this psychological or this psychiatric assessment that you're going to get conducted in the custody, that can aggravate this ischemic heart disease, and he or she might want to have the particular treatment with the individual. Now, then even certain emergency conditions, for instance, asthmatic conditions with bronchospasm usually can be aggravated whenever there is some sort of a custodial interview. It's not usually the circumstances, it's not you as a healthcare professional that is threatening. It's basically the environment that is threatening. All that social pressures and all that social distractions is going to make all these conditions worse, and usually it is not a necessity to carry out the interview whenever there is an acute asthmatic attack, whenever there is an acute myocardial infarction and you want to conduct. Obviously, you're going to treat the patient and you're going to provide the emergency and stabilize the patient, and only then you're going to consider that this particular patient is fit to conduct this particular kind of an interview. Then a lot of diabetic patients may go into hyperglycemic states, may go into hypoglycemic states, and you have to consider these emergency states even over here. Moreover, we have migraine, we have severe anxiety, and we have panic attacks. So all the conditions, conditions which are usually tension-induced, It can be a headache, it can be a migraine, anxiety, panic disorders, acute panic attacks can be basically instilled in individuals whenever they hear that they're going to be psychiatrically assessed and an interview is going to be conducted. A psychiatric or a forensic psychiatric is going to be here anytime, and they have to basically have that interview. So all of these conditions, all of these physical conditions can basically worsen out, or they can aggravate in this particular state over here. So we have to avoid any sort of discrepancy, and we have to avoid any sort of emergency states, and it should be in a very relaxed and calming situation that you conduct as much as possible, of course, that you conduct this particular forensic assessment that is related to the psychiatric evaluation of the detainee. What is going to be your scheme of examination? And obviously this examination is related to the interview. It's the verbal examination that you're going to have while you are conducting, as a doctor, you're conducting the interview, and you are assessing the mental capacity or the mental health of the individual. First of all, the reason for arrest. And has the patient any insight regarding this charge? What can be the circumstances if he's proved guilty versus if he's proved non-guilty? So does he know the difference between all of these circumstances? Does he have the insight towards it? It's very important. So this is again very important, and again we are going to have the statutory warning. And does the patient or does the detainee have the insight towards the statutory warning or not? Because when he is basically recording or his statement or documenting his statement, you must tell him that you have been charged with so and so crime. So do you know about this particular circumstances or not? And if you know about it, you may not even comment upon it, but this is very important that you tell us the details right now, because the details that you're going to rely upon when you're going to defend yourself in the court are very important, and you can add on those details right now, right here in your statements. So this is going to help you out when you're defending yourself in the court. Giving the insight to the detainee is very important. I must tell you one thing, that every state has this Mental Health Act, and every state has the rights that are given to the detainees as well. A lot of citizens are not aware of those rights. And so it is basically the right of the citizen, it is the right of the detainee to have a fair trial. The right of a fair trial is the right of every citizen, usually in all of the states. So this acknowledgement is very important. This awareness is very important. Sometimes a lot of mental conditions and a lot of conditions which basically hinder your mental capacity, they bring a lack in your judgment, in your decision making. And even for that purpose, these states have different laws that are basically called as the mental health laws regarding it. Now, any unusual factors surrounding the circumstances of arrest that were noted down by the detainee himself, or even if he can remember those by recalling the incident again and again, and he can basically add on to the details more and more. Any unusual behavior since arrest, it can be a panic attack, it can be an aggressive behavior. So if there is any sort of an aggressive, if there is any sort of an aggression that is noted down over here, that has to be noted down and that has to be documented in your history over here. Any warnings on the PNC or concerns raised by the risk assessment. So whenever you conduct this interview, you have to have the risk assessment done. If it is done previously and any positive signs were noted down, you have to note it down and you have to document in your findings as well. Proposed time and likely length of the interview is very important. It should not be lengthy enough. It can be even short durations, and you can conduct the interview in 2 different sitting sessions as well. Any relevant property, any property disputes that are going to be highlighted over here at this point in time. Now, a general medical history. History of substance abuse is very important. History of past surgical and medical history, hospital admissions, any drug abuse, any drug allergies, the sleep patterns that the patient is having, they are going to be noted down in the medical history of the patient. Psychiatric history is very important. Has he been going to a psychiatrist or been on any kind of a prescription that is given by a psychiatrist, or is there any kind of particular diagnosis made by a psychiatrist previously? If there is, that is going to be very helpful for you as a forensic practitioner in this particular case that you're dealing with. Then any kind of a medication, it can be a long-term medication that he or she might be using, and you're going to note that down. Then use of illicit drugs or any alcohol intoxications that he might give you possible history of. Last meal that was taken is very important, and who gave that meal to him, because sometimes drugs and alcohol are added on to the liquids or they're added on to the meals, and that can basically intoxicate the individual, and certain crimes are carried out due to that intoxication period that follows on. Sleep patterns are again very important. Last period is very important. And what was the time duration of the sleep? Any episodes of insomnia that the patient might be suffering from? Social history and any kind of forensic history is again very important over here. And then obviously the occupation of the individual is again very important over here, and that is going to highlight the amount of rest periods that he has in between his duration of work. So this is going to evaluate the general mental health status of the individual and the general mental capacity of the individual that we are interviewing. Then the educational background, as we were already emphasizing on the fact that low IQ and a poor educational background is basically going to highlight the factors that the person might be suffering from an autistic disorder, as well as some of the personality traits that is compliance and suggestibility. They are usually associated with this kind of an educational background over here. The general physical examination is very important, and then we have the signs of drug dependency, intoxication, as well as withdrawal. So you would start off with the general physical examination that would basically include all of the vitals, including the temperature, the respiratory rate, the blood pressure, and any fever if it is documented, and you're going to note that down. After having done with the vitals, you're going to carry out the general systemic examination, including the nervous, and may not be a detailed examination if he or she is not suffering from any sort of a particular disorder, but we can conduct any kind of examination if we want to. Signs of drug dependency are noted down, and for instance, it can be tremors and any disorders of gait are noted down in cases of alcohol intoxication. Moving on, we have the MMSE, that is the Mini-Mental State Examination. This is a brief mental state examination which is carried on in this particular kind of case, and then we have a functional assessment for this particular individual. So then we have the fitness to plead. This is again very important. Whether the patient has an understanding towards the charge that has been put on to him or that he has been subjected to, and what is the difference between a guilty versus a non-guilty person. So this is very important to give him or her the insight towards these factors. As I was emphasizing on the fact that having the insight knowledge towards these factors is very important, because usually patients who are suffering from mental disorders or psychotic disorders, they usually lose the insight towards these specific conditions over here. Then we have different acts which are related to the mental capacity, and one of the Mental Capacity Act, which was basically documented in 2005 in the UK and Wales, it basically is applicable for people who are above the age of 16 years and they are incapable of deciding for themselves. So basically, the state decides for themselves on their behalf, and this is how it is being carried out. Obviously, you carry out the mental assessment for this particular individual and document whether he has that mental capacity to make the decisions or not. There can be any sort of psychotic or physical disorders that lead to this particular sort of incapability of making appropriate decisions for himself or herself. So this is, again, very important over here. We have the mental health legislations working in particular static conditions. So this is very important that the detainee oneself should know what are the rights that he has the access to. For instance, the right to have a fair trial is one of the rights that is given in all of these states, and he should know these factors and he should be well versed and he should be well aware of this particular rights that his state give him, and he should know how to basically inculcate these rights when he's making certain important decisions over there. Now, in some conditions, we have to have this compulsory hospitalization. Why is it carried out? It can be some sort of physical ailments, it can be some sort of psychotic conditions that the patient might be having. Informal or compulsory admissions are carried out in cases for the admission for assessment. Now, whenever we say the admission for assessment, it's usually done for a time duration of 28 days, and usually two doctors, they make a team and they assess the patient in different periods of time, and they have their own documentation after assessing the patient psychiatrically, having conducted different tests on the patient, and then giving out a final verdict for this particular kind of patient. Then we have the admission for treatment. It is usually done for a period of 6 months, and moreover, we have the emergency admissions or assessments, and they're usually carried out for a period of 72 hours. When I say the emergency assessments, usually it can be the diabetic patients, it can be the hypertensive patients, it can be patients in the acute asthmatic attack. So these are the usual patients that we usually deal with, and we should know how to and when and how and what is the time duration that they can be admitted to the hospital. So this is an informal compulsory hospitalization that can be carried out. Now, the diversion from the criminal justice system can be done by the court diversion schemes, the remand of the accused persons to the hospitals. These are some of the diversions. In special cases, they are applicable. We can have the hospital orders for the convicted prisoners over here. And even we have the transfer of the prisoners to the hospitals whenever they are suffering, and after a doctor's visit, when they are assessed and the doctor basically gives a verdict that he or she needs a particular kind of a treatment, after that the prisoners can be shifted to the hospital for a proper treatment of the emergency ailments as well as the debilitating ailments over here. So the forensic psychiatry services, we have the different kind of services that are available, including the special hospitals in which the detainees are usually kept, that are basically, this is usually for the safeguard of the patient himself as well as the people who are surrounding him. Then we have the regional forensic psychiatric services. They are located in all of the cities and all of the towns and even in the suburbs. And then we have the general adult psychiatry services. Usually even the walk-in clients can come up, the walk-in patients can come up and have their assessment done. So these are some of the psychiatric evaluation centers that are made. And then obviously we have the independent sectors that are being run by different doctors. They might be the general physicians, they might be the psychiatric counselors, they can be the psychological counselors. So all of these can basically inculcate to be a team and have that independent sector where they can perform the psychiatric services and the psychiatric evaluation of the individuals on a whole. Now, having done with this kind of the forensic psychology, we must know the factors that why is it important to consider and why is it important to basically go through all of these facts. As a doctor, you must be basically well versed with the legislations, that is the mental health legislations of the country in which you're practicing, because this is very important over here. To evaluate the factors and have the particular system for the assessment of the individuals, to assess and to basically make the investigations more fruitful after a significant interview with a forensic practitioner or with a forensic psychiatrist. Whosoever it may be or whosoever it may concern, but you have to conduct the interview and you have to basically inculcate the legal aspects as well when you are conducting the interview with the patient. So over here, while we were dealing with the forensic psychiatry of the individuals, we just went through the facts that why is it important to conduct this forensic interview? Why is it important to assess the patients in a particular manner? It is for the safety of the detainees, it is for the safety of the society, because basically whenever they're going to be charged with a particular kind of a crime, and even if they're found guilty, when they're released on bail or even when they're released after getting a certain amount of a punishment, they have to be analyzed, they have to be assessed in a particular manner, and if they need any kind of psychological counselings, if they are needed, that is going to be highlighted over here. Even the particular diagnosis can be made in a particular manner over here, and that is very important to conduct the forensic interview in a particular manner. So that is the end to this lecture. Thank you for watching sqadia.com.